Hi, my name is Alicia and I am a student at the American College of Healthcare Science. And today's talk is going to be for any new moms, any partners of new moms, soon-to-be moms, family and friends of new moms who wish to breastfeed their new baby. And so I'm going to go over a few things that might help you when you get started breastfeeding, help you to be more successful, and help you to avoid some of the troubles that people run into when they start to breastfeed. So breastfeeding is the most natural way to feed your baby, but it doesn't always come naturally. I think that's probably the biggest misconception that people have with breastfeeding, is that the baby will be born and he or she will just know how to breastfeed automatically, and sometimes that's not always the case. Sometimes it is the case. My son was born, the doctor placed him on my chest, he nursed right away. One minor correction from a lactation consultant and we were good to go. We never needed help again. However, my daughter had a tongue tie and a lip tie and a shallow latch, and we needed a lot of help from lactation specialists and doctors and nurses in order to successfully breastfeed. So everyone's journey is going to look a little bit different. Statistics also show that babies born via cesarean are less likely to be breastfed, and that can be for many different reasons. One being that if a baby is born via C-section, it's probably because there was an underlying health cause, and that may affect breastfeeding, or also some babies born via cesarean are premature, and if a baby is premature, they don't always have a good latch, and they don't always have that sucking reflex down as a full-term baby would have. So that can hinder breastfeeding. So if you know that you're going to have a C-section, or that you fall into a risk category for a C-section, and you know that you want to breastfeed, you might want to take an extra class or read a book or just get some help to prepare before your baby's here, so that you know exactly what to do when the baby's born so that you can successfully breastfeed. So the best thing that any mom can do for getting breastfeeding started off right is to do skin to skin. So when that baby is born, however physically possible, the soonest you can get that baby onto mom's chest, skin to skin, that's going to promote bonding between the mom and the baby. And a lot of times the baby will then latch whenever they're ready. And that's just, studies have shown that it's more beneficial for babies who are skin to skin. They will be more likely to want to latch on than a baby who is whisked away and taken from the mom and separated for long periods of time. But we can't always control that. Sometimes there is medical emergencies that do interfere with that. But if you don't have any of those emergencies, get that baby onto the mom as soon as possible. Also, a lot of hospitals provide lactation services now. They have a nurse or a specialist who goes around and visits your room and helps you get that first initial latch and helps with any questions you might have. So if your hospital has one of these people, then make sure sometimes you make an appointment with them, sometimes you just page them. The hospital that I was at, you would just send the lactation consultant a page on her phone and she would come to your room and help you. So be sure to ask the nurse or the doctor, whoever you need to ask, to get that person in your room before you go home. They're generally free for that first consultation. You can ask them questions, and that can be a really good tool for you. They can show you not only how to latch, but different ways to hold your baby, because there are different ways to hold babies when you're breastfeeding, and some babies like to just be held like a cradle, some like a football hold. Sometimes babies are really, really picky and they'll choose one particular hold and they won't want to breastfeed in any other position. So if you don't know those positions, that can be a problem. So ask your lactation consultant to show you these different positions in which you can hold your baby. And always remember that this is going to be a learning experience for you and for your baby. Your baby is brand new. He or she has never breastfed before. So give yourself a break, give your baby a break, and know that this is a journey and you're learning. So it's going to take some time. So your baby will learn to eat, I promise. And another thing, many doctors believe that your baby will be hungry right away, right when they're born. And that's just not the case. When your baby is born, they survive off what's called brown fat. And a lot of babies will lose weight right after they're born because they're burning that fat. they can lose up to 7% of their body fat. And then from there on out, a breastfed baby will gain about 6 ounces a week. And your doctor or your midwife will want to weigh your baby quite frequently. A lot of times you'll go back for a 2-week checkup, and then sometimes a 4 and a 6. It just depends on your doctor and how well your baby's doing. They might want to weigh your baby weekly if they're having trouble gaining weight. So just remember that. Let's see, what else? Also, try not to stress out, because stress can really put a hamper on your milk supply. So when you are having those difficulties, if your baby isn't latching right away, or your baby is losing weight, not gaining as much as the doctor would like, try to relax and not stress too much, because that will just make your milk supply go down further, and that's obviously not what you're wanting to have happen. When your baby is born, a lot of people don't know this, but their tummies are about the size of one of those little glass marbles that you play with when you're a kid. And so it's really easy for the baby to fill up on colostrum by itself. And colostrum is that first milk that comes out before your milk comes in. And it's usually a little bit thicker than milk. It's usually more of a golden color. And it's super nutrient dense. Your baby will get full on this colostrum, on this first milk. And that colostrum also helps to promote a healthy immune system, which is why they say babies who breastfeed for maybe only a couple of days or weeks, it's still so beneficial for them, because they get that colostrum, and that's what doctors rave about, is that first milk. And it can take anywhere from 2 to 5 days for your milk to come in. So just be patient, keep nursing, nurse on demand. Whenever your baby wants to eat, go ahead and feed the baby. Some people will say you have to nurse every 2 hours, you have to nurse every 3 hours. They'll give you a schedule, but if your baby wants to nurse every half an hour or every hour, go ahead and do that, because they're going to stimulate. They're telling your body to tell your hormones to bring in the milk, that the baby is here. So if you're ignoring that baby, you're telling your body, don't bring any milk. So feed your baby on demand. That's so important when you're first beginning your breastfeeding relationship. It'll feel like all you're doing is breastfeeding, because all you're doing is breastfeeding for those first couple days, and sometimes first couple weeks. But there's no such thing as too much breastfeeding. Your baby knows what to do instinctively. He or she knows how to bring your milk in. So just trust your baby, trust your body. You can make the milk, I promise. Just keep on nursing. So you're going to want to nurse baby on one side and try to get them to finish that feed until they want to unlatch, and then offer the other side. What this does is it makes sure that you fully empty one breast before switching. And the purpose of that is when you first start nursing and you feel that letdown, you'll get that foremilk, which is the milk in the front of the breast, and it's watery and it's very thin. Some people who pump will say that it almost looks like water when it's in the bag. It's very thin. And then the hind milk behind that is the thicker, fattier, more white or sometimes yellow milk, and that's got more nutrients in it. It's more beneficial to the baby. If they're not getting enough hind milk, they can get a foremilk hind milk imbalance, and that can be an upset stomach, gas, or sometimes they'll have green poo in their diapers. That's a big indicator. My son actually had that for a little bit, because no one had told me that, to empty one side before switching, and I was watching the clock and doing 5 minutes, 5 minutes, 5 minutes. I don't know where I got that from. I just made it up in my head. So constant breastfeeding is also referred to cluster feeding, and that's what your baby's going to do in the beginning, is they're going to want to cluster feed, just feed all the time. And it's normal. It will go away. It may come back when baby decides to go through a growth spurt, and it will also, your baby might want to cluster feed again when you're, if they get sick, they'll want to cluster feed, and what that does is it provides them with comfort while they're sick, and it also gives them lots of antibodies that are in your milk, so it can help them get better faster. A lot of people refer to breast milk as like nature's antibiotics. So you'll want to breastfeed through illness, and you'll want to breastfeed through if you have an illness, if you have a cold or a flu. If you're able to breastfeed your baby through that cold, keep on doing that, because you're going to pass on those antibodies from that cold to the baby, and they may not even get sick from it. So don't let that shy you away if you get sick, to continue breastfeeding if you're feeling well enough. So some signs of hunger in an infant. That can be kind of hard to tell since they can't talk and they do cry about many different things in the beginning. Different things they'll do when they're hungry is rooting, and that's usually when they turn their head side to side and they're looking for a breast. When they do that, they may stir around in their bed. If you have them in a little sleeper or a crib or whatever you have them in, they'll kind of move their arms and legs and stir around, and that can be a sign of hunger. Also, probably the most obvious sign of hunger in a newborn is chewing on their hands. So be sure to keep an eye out when your baby's hungry. You can sometimes tell before they even start to cry that they're hungry by those signs. And let's see, other than weight gain, a good way to tell if your baby is getting enough breast milk is if they have enough dirty diapers during the day. So a good rule of thumb is if your baby is 1 day old, they should have 1 wet diaper. If they're 2 days old, they should have 2 wet diapers. And that also goes for dirty diapers as well. So be sure to, sometimes the hospitals will give you a little booklet to write down and record how many diapers your baby has had, how many dirty diapers they've had since birth, and your doctor or your nurse will come in and take a look at that and make sure that that's looking good. They can have more dirty diapers than that. If they have more than 1 wet diaper in the first day, that's okay. So one problem that moms should look out for when beginning breastfeeding is engorgement, and that just means that your milk has come in. It can be painful, but it's totally normal. So a few ways to deal with that are, my favorite way to deal with engorgement is hand expression, and that just means using your hands to express a little bit of milk off the top of the breast so that it's not so tight and painful, but it's also not going to take out a ton of milk, so you still have milk there for the baby. A warm shower or a hot bath, that can also help relieve that milk off the top. It'll be soothing to be in the hot water. It'll feel a lot better. Hot and cold compresses, those can be nice. They have kinds now that you can either put in the microwave or put in the freezer. Those can help with the pain. Pumping is another way to deal with engorgement. It's not my favorite way to deal with engorgement because when you pump that milk out, you're telling your brain, make more milk at this time. So then what's going to happen is you're going to continue to be engorged because your body thinks that you need all that milk at that time. So you can pump. Let's say maybe you plan on going back to work pretty soon. So you can pump out that milk when you're engorged and put it in the freezer for later. Or you can donate it if you wish to donate. Or if you just want to have a big stash of milk, you can pump off the engorged milk and save it for later. That's a great idea too. Probably my least favorite way to deal with engorgement is the cabbage leaf compresses. So you would just get the cold cabbage leaves and put them inside of your shirt, your bra, whatever you're wearing. And the cabbage actually makes your breast make less milk. The thing about that is you don't really know how much is too much, how much is enough. So you don't want to hinder your supply by doing it too much. But it can be a good tip if you are trying to dry up your milk. If you're done breastfeeding your baby, you can use the cabbage leaves to dry up your milk and be done. So it can be used for both purposes. You don't want to stay engorged for too long because you run the risk of mastitis, which is a painful breast infection, which will most likely require the use of antibiotics. It can come on pretty suddenly. The signs of mastitis are fever, body aches, chills, painful breasts, redness, hot to the touch. It kind of feels like a flu a little bit, so if you're feeling that way and if you know you've been engorged and you're feeling kind of flu-like, you might want to call your doctor or go see the urgent care. That's what I usually do because it can come on really, really fast and you want to get it taken care of before you get really sick. So that's all I have for you today. I hope that these tips have helped you a little bit, taught you a little bit about the beginnings of breastfeeding. If you have any more questions about breastfeeding and getting started right, a few of my favorite resources are kellymom.com, anything from Dr. Jack Newman, your local La Leche League. You can contact them. You can find them on the internet. A lot of times they have an email service. I've emailed those ladies so many times, and they help you for free. And they also have meetups, which I've never been to one yet, but they will get back to you via email. They're really good about that. Also, your local health department. I don't know what you have where you're at, but our health department has a WIC office, and they usually have peer counselors who can help you troubleshoot any issues that you might have when you start breastfeeding, latch issues, engorgement issues. If you're concerned that your baby's not gaining enough weight, they'll weigh your baby for you there. So those are a few of my favorite resources. If you have any other questions besides that, feel free to get a hold of me. I would love to help you. I nursed my son until he was 2, and then my daughter's now 6 months old, so I've got a lot of experience. And I love to help people, and I love to help people breastfeed their babies. So if you have any other questions, just let me know.